In this time, in this era where calls coming into 911 are this heterogeneous mix of high acuity, time-sensitive critical emergencies, and then we have a huge amount of calls that come into 911 and they need more conversation and they need more connection to care as opposed to a rapid response with 2 paramedics and an ambulance with a stretcher. Much of the time that's not what they need at all. They need to connect with the paramedic and they need to understand what their options are in the healthcare system, and that's what the Clinical Hub does.
The Clinical Hub was established in January of 2022, and it was really designed around providing our patients and paramedics with a support network to get their access to the right care the first time they contact the 911 system.
Patients were waiting upwards of 6 to 12 hours for an emergency ambulance. Patients weren't getting care in a timely manner, and also their appropriate care.
So BCEHS and PHSA worked together to create a new program in the Clinical Hub with new clinical roles, which allowed us to help the British Columbians and our patients get the right care the first time.
It's a team of very high-performing paramedics who take those calls. They call those patients back, and their primary objective is to connect those patients to the care they need.
The Clinical Hub is a diverse group of clinicians that involve secondary triage, low-acuity patient navigators, and paramedic specialists. And what our roles are is to make sure that we're supporting employees and paramedics in the field, but we're also supporting patients with their complex needs that may not be served best at an emergency department.
I think one of the biggest outcomes that has been really positive is that we're reaching more patients. So it's really improving the health equity throughout the province. Since the Clinical Hub started in 2022, we've connected with over 66,000 patients throughout British Columbia.
They're a really innovative group. They rise to any challenge, any opportunity. They've really they've been the pointy end of change in our organization now for a couple of years. Figuring out new ways, new models of care within paramedicine, that group is leading that change.
And really the reason that we're doing this is to provide patients with that right-sized care and ensure that our emergency ambulance resources are available to respond to the next high acuity patient.
An amazing accomplishment for the team, and what a wonderful recognition from the Canadian College of Health Leaders to recognize the efforts of this team and to also recognize that healthcare is changing. And it takes a lot of innovation, it takes a lot of creativity, it takes a lot of time and energy to introduce new models of care. And for the college to recognize this group, we are truly grateful.